your question. So again, this is the Hamilton County Nonprofit Relief Program webinar for eligible services, Category 2. My name is Emily Carnahan, and I'll be walking through this with you today. So if you were unable to attend our webinar a couple weeks ago or view it online, just to give sort of an overview, Hamilton County received $158 million through the American Rescue Plan. And the commissioners have set some priorities and created some programs, including this one. So they allocated about $6.3 million to continue to support Hamilton County nonprofits. So United Way's role is running the proposal and selection process, and we will also subcontract with the selected grantees and disperse the funding. And we will also be collecting the expense source documentation and any other reporting elements. So if you're selected, your role will be to submit your required reporting, including, if you come in under hardship, any expenses, any reporting, etc. Okay, so if you're attending this webinar, your organization should have submitted a pre-application. It was required to sort of help people understand some of the requirements of the program and see which category they best fit under. That pre-application is closed. Some of you attending today are also applying under the organizational hardship category, so that's open. And those applications are due Tuesday, January 18th at 5 p.m. All of you attending today are likely eligible for eligible services category 2. So you'll be emailed instructions to apply on Wednesday, the 12th, and that deadline is going to be Sunday, January 30th at midnight. And then we expect to communicate all decisions by March, hopefully sooner, but they should all be communicated by March. Okay, so we're going to go through some of the organizational eligibility. Before we even get into categories, I do want to go over just, is your organization eligible for this program? Because there are several criteria for that, and we've had a lot of questions on those as well. So the primary thing, the purpose of the program is so eligible nonprofit organizations must provide essential social and family services, and they either must have been impacted by COVID-19 or provide services to Hamilton County residents who are impacted by COVID-19. Another important piece I want to point out that we've also had questions on is that the grant minimum and maximum is $25,000 to $250,000, and that is per organization. So if you're coming in under both hardship and eligible services, your total organization minimum is $25,000, and your total organization maximum that you can receive is $250,000. A few other criteria. So you must be a nonprofit with 501c3 tax status. You must provide essential social family services, be operated for charitable purposes or community benefit. You must have a location in Hamilton County and provide services within Hamilton County. A few ineligible organizations are for-profit companies. If you do not have 501c3 status, newly launched nonprofit organizations are not eligible, and then arts and culture organizations and schools. There is an exception for arts and culture organizations if you provide an essential social family services, such as like food assistance. You have this ongoing program. There are going to be a few exceptions there, but the county is actually going to have a specific arts and culture program for those organizations that don't provide the essential social and family services. So even if you're a nonprofit, but if you're strictly arts and culture, you'll want to apply under that separate program. Eligible organizations must also be registered in good standing with the State of Ohio Attorney General's office. They have that charitable registration. If you do not have that and have not done it yet, please do so. You will need that in time to be able to upload it for the full application, but you're welcome to do that if you haven't already done it. You must be in compliance with all Treasury regulations, including those applicable to your status as a 501c3 and a nonprofit organization under Ohio law. You will also need to certify that this funding that you receive through this program will not be used in place of or instead of other local, state, federal, or other funds already designated for that expense or activity. So there's a form that we have that you'll need to download and fill out and sign. And it's basically saying it's about duplication of benefits. If you already have funding for a specific expense, we cannot also fund that same expense. So we're happy to answer any questions, if you have any specifics that you're wondering about. Eligible organizations must also have been in operation since March of 2019. And again, you must provide the essential social and family services. The biggest question, and I think the biggest issue for some organizations, is that you must be able to provide recent, which is 2019, 2020, or 2021, independently reviewed or audited financial statements. So independently must mean it can't be somebody from your own organization or an organization that you're like a subsidiary of. It has to be like an independent CPA must either need to have an audit, which those are the large organizations. If you have an audit, you know it. That's usually not an issue. If you're not one of those large organizations, we do still need reviewed financial statements. So an independent CPA would have looked at your financial documents, and they produce a letter that says there's no like material modifications. It's a specific thing that your accountant should know. It is not a compilation. Unfortunately, it's a step up from that. So if you have a compilation, that does not meet these requirements. So please email us at impact@uwgc.org if you have any questions about if you qualify under this criteria. It's unfortunately not something that we can really work with you on. We can definitely, by that I mean we can't, it's not negotiable. We can work with you to determine if you meet this criteria, what we need to see. But we don't want you to spend a lot of time on the rest of the application if you're not going to meet one of these organizational criteria. So please do email us, call, if you have any questions. Okay, so as I said, today we'll be discussing eligibility under Category 2 eligible services. So since you're on this webinar, you should have already completed the pre-application and it receives the message that you're likely eligible under Category 2. You should have also received the confirmation email inviting you to the webinar, or it was probably forwarded from someone else in your organization. This webinar should help you validate your eligibility under Category 2A and or 2B, and help you to understand the documentation required for you to demonstrate that you're eligible and can submit eligible reimbursements. Okay, so just another quick overview. If you attended our last webinar, this might look familiar. So you can see over on the very left, that's the organizational eligibility. So that's what we just went over. Like before we even get to what services you provide, like is your organization eligible for this program? The top one is the hardship. Some of you are also applying under that. And then you can see down below, we have the eligible category number 2, eligible services due January 30th. And there are 2 subcategories, 2A, which is responding to specific negative client impact, and 2B, which is responding to impacted populations. So that's what we're going to go over today. Just real quick, we're not really going over this organizational hardship. This is due January 18th. If you have any specific questions related to an organizational hardship application, please email impact@uwgc.org. If you're eligible under this hardship category, the person whose email was provided in the pre-application will have already received an email with info to log into EC Impact and complete the full application. So if you're unsure, ask whoever completed the pre-app in your organization, if they've received that. And if not, please let us know and we'll get that taken care of. Okay, so we're going to start with 2A, which is responding to specific negative client impacts. 2A and 2B are very distinct. They have different eligible services and different eligibility criteria. So please make sure that you're clear on which services your organization provides and that you're applying under, because we're going to go over each more in depth, but they are very different. So under category 2A, these are the eligible services: job training for the unemployed, job training for the underemployed, food assistance, emergency assistance for home repairs and weatherization, behavioral health care, which is defined as mental health treatment, substance abuse treatment, hotlines, crisis intervention, overdose prevention. So just going over a few different aspects of this. So these services need to be consistent programs. They shouldn't really be ad hoc and frequent type of things. You should have set programs that you run to apply under this category. And the priority will also be given to existing programs and services. If you're trying to start up a program that falls under one of these, it is eligible, we'll definitely review it. But if there's a need, like if we don't run out of funding, the priority will be given to existing programs. So you can see there's a definition. We provide a definition of what underemployed means. They're on the right. And the job training must get someone a job. This is also for clients. It's not for job training for your own staff. So this is providing a service to Hamilton County residents. And then food assistance, I just want to be clear that this is cannot be gift cards. This is direct food assistance. So if you apply under this category, you'll need to provide detailed documentations for all expenses. And you'll also be able to have all clients certify, or we call it a self-attestation, that they have a need for the provided service due to COVID-19. So we have a sample that is in AC Impact that we can share, and you can adjust it if needed, but it essentially has the client certify or attest that they had a need for your service that you provide due to COVID. So this will also look familiar to those on the webinar last time, or this is also on our website. But basically, you already answered all of these questions in the pre-application in a way that makes it appear as though you're eligible for the program. So basically, the full application is just validating the answers that you supplied in the pre-application. So you'll provide some narrative, limited narrative in some cases, but it'll need to be specific and detailed, and then provide the documentation to support the services you provide and the expenses, which is what this slide is. So this is what you'll need to be specific about in the application. So for each eligible service, so if your organization provides job training and food assistance for each program or service, you'll need to provide a detailed description. You'll also need to be able to demonstrate that you can provide the client attestations and need for the services due to COVID. And then you'll also need to provide a description of the expenses for the services that you intend to apply for reimbursement. So at this point, you're not actually applying for reimbursement. You'll provide that documentation on a monthly basis after you've been awarded the grant. But we'll need, like I said, like a sort of a narrative description of what the expenses are, and then there are budgets. And so the time frame for the eligible expenses is a little tricky. So essentially, the intent of the American Rescue Plan is generally forward-looking. However, eligible expenses, they're technically eligible going back to March 3rd of 2021. However, if you intend to go back and request reimbursement for past expenses, we still need all the documentation, including client attestations, including all the documentation of your expenses. So in almost all cases, organizations will only want to apply for reimbursement for expenses moving forward so that you can meet all of those different criteria and have all of that documentation. So in the application, there are two different budgets. The first one is going to be for 2022 expenses. So those are going to be the ones looking forward. So everyone can fill that out. And then there's an optional budget if you do think that you can apply for the past expenses. It'll be broken out into a separate sort of budget table for you to put this specific document, the specific budget items from March 2021 to December of 2021. Continuing on expenses. So this slide was also in the previous webinar, but these are some ineligible expenses. So the thing to know about this category is that the expenses must be directly related to providing the eligible service. So obviously these first few things aren't eligible. Again, gift cards are not eligible, entertainment costs. And again, indirect costs must be broken out separately and have detailed documentation. So for example, if your organization has like 4 different programs and you're only applying for the food assistance one, but you want to get reimbursed for some of your IT services, you would have to break out the proportional amount to the food assistance. So it would be, a fourth, or, however it can be broken out proportionally to the eligible service. So please let us know if you have questions about that. Eligible expenses, again, eligible expenses must be directly related to providing the eligible service listed in category 2A. So salaries and benefits, again, only the portion dedicated to the eligible service. So, obviously if you have like a case manager and they only work on this eligible program, then, you can request their, whole salary and benefits for the, specific time period. If it's, like a finance person, maybe you need to break out their salary and benefits proportionally to this program. Obviously, direct assistance is eligible, materials and supplies, equipment, technology. You will need obviously expense documentation, invoices, canceled checks, anything that shows that you've what the amount was and that you paid it. Rent, utilities, again, only the portion dedicated to the eligible service. And then there is a specific line item for any new expenses. So we want to have those called out separately in the budget. Excuse me. Okay, I think this is a good time. I see a bunch of notifications in our chat to stop for some questions specifically related to category 2A. Amy, do we have anything we should talk about?
Yeah, we have a couple here that I'm just typing answers to, but we can go ahead and share what they are. So a couple of questions about one, back to finances. So a question of if folks need to provide both 19 and 2020 audited or reviewed financials. We do not. So one of those years, we'll need to upload that. There was a question that a final audit occurred in 2019, but was reviewing the fiscal year of 2018. Does that qualify? I think we actually need a.
Yeah, well, I think we'll need to check on that. We haven't had that specific question. So we'll get back to you on that.
Yes, and Mary will confirm whether if that would be eligible or not. And then we had a question around, there's a couple questions around client attestation. So one question initially was, do they have to sort of solely attest that they're coming to us because of COVID or because that there was an increased need because of COVID? And then there was a question of sort of like, do they need to be new clients or can it sort of be just current folks that are visiting that attest. So I shared that just to be transparent, we're using the word client to really indicate individuals served by the program. So there isn't a need to look to find new, to sort of serve new folks, right? It can be individuals that are already accessing your services. But the big thing here to note is that we'll need attestations for individuals served ultimately by this funding. So for any programmatic expense under 2A that you wish, if you get funded and want to use and wish to submit for reimbursement, that needs to be connected to providing services to individuals who are qualified, and the qualification is sort of eligibility is documented through their attestation that they had a need for that service due to COVID. We have an example attestation that's going to be in the system that you can reference. And Lindsay asked exactly what that phrase will be. We can get back to you on that. I don't have it offhand. Maybe I might be able to pull it up, but we can share that specifically. And then there was another question around if you are a food pantry and employment service, what specifically is the client attesting to? Then the attestation is that they have a need for that food service or employment service due to COVID. And I do think that that is pretty broad. We're saying that due to COVID. And we had a question in the past around documentation of that specific reason of the need. You will not need to collect anything beyond an attestation or a certification. And there was a question to say, if we were closed due to COVID, how would the client submit an attestation? This is going to be for expenses that are likely forward looking. We're going to get into that in a little bit more. So it's not looking back necessarily, but looking forward. So as you continue to deliver those services, you'll need to collect client attestations.
Yeah, if you're trying to get reimbursement for past expenses, you're going to need those attestations. So it's going to be really difficult. So almost all organizations are going to want to apply just for expenses moving forward. And I will say the sample attestation that we have that you guys will be able to look at, edit. One of the reasons that we that it's just sort of like a sample for you guys to use and alter as you need to, is for organizations like the example that provides employment services and food assistance. You can combine that. You don't need a separate attestation for each service as long as their both services are listed in the attestation. So you can include that in the one form. Anything else right now, Amy, or should we go ahead?
Just a couple more questions. Let me make sure I get them out. We can send out, when we go to send out a notification to let everyone know that this webinar has been recorded. I think we'll be able to, we could maybe attach the attestation at that time. It's also going to be in the system, which was scheduled to, the application is scheduled to open this week, right?
Wednesday, yeah.
Wednesday. So as early as Wednesday, it would be accessible, just in case we have any problems attaching it to the email. There was also, and so it is fairly simple. Emily, can you talk through just real quickly, like what the data fields on that attestation form are from memory?
It is super simple. Honestly, it could be like, you have sample attestation form, what your organization name is, and you just basically, the important part is you put like I and then leave a blank for their name, and then basically have a need for, and then insert whatever the service provided is, the eligible service, due to COVID-19, or I have a need for this service due to negative impact due to the pandemic, and then it basically has a little certification, by signing below, I certify that everything is true, etc., and then just name a date. Those are the main fields. It's a pretty simple form.
There was a question around eligible expenses, so I don't know if we want to go back to that and just give
Okay.
some examples, or if you feel like we talked through that? Yeah, great. So do you mind just talking through this a little bit more, examples of eligible expenses, particularly like using the context of food assistance as an example?
Yeah. So so if your organization provides food assistance, so salaries and benefits, so anybody directly related to providing that food assistance, so the pantry workers, anybody doing like intake, their salaries and benefits, you can apply for those expenses for reimbursement. And then, like I said, if it's somebody indirect, you have multiple programs, or they only work partially on food assistance, like so I'm thinking of like HR, like financial assistance, like you would want to break that out as a portion. So it depends on, what other programs you provide, like what that portion is. But we can definitely reimburse for the portion that their salary is dedicated to the food assistance. Direct assistance obviously is the food. We can reimburse for those expenses. Any materials and supplies, so and equipment and technology. So, if you do intake on tablets or something, we could, reimburse for, if there's like a software, we could reimburse for the months, that you're applying for that subscription. Any materials and supplies for the time period that you're applying for, and you have the documentation for, we can reimburse for that.
And let me just, sorry, Emily, so let me just clarify. I didn't read Melissa's chat all the way. And she just chimed in to say, specifically new expenses. So what do we mean by new expenses?
Okay, so new expenses are going to be, so in the example of food assistance, it's going to be something that you don't normally apply for. So if you're trying to do something new with your program, something like that, we just want those sort of broken out in a bit more detail. So if it, and also like if it just doesn't fit in one of these categories, that would be a place to put those as well. And so that's for something like food assistance. If you're an organization that's doing a new service, we probably don't want all of your expenses in the new expenses category. We'll still want you to break it out. So Amy, do you have anything to add on the new expenses?
Nope, I think that's it. We really just want to understand sort of what's already in place and what might be new to understand how the fundings will be used.
Great. And then just to finish up with the right and utilities. So again, so for food assistance, if you have like a warehouse where it's only dedicated to housing, distributing the food, we can reimburse for that rent and utility for those again, the time period that you're applying for. If it's like your main office, again, that would have to be sort of broken out by the portion dedicated to the food assistance program. So hopefully that's a little bit clearer for folks. Any other questions?
Yeah, a couple questions about prorating salaries.
Okay.
Which it's a good question. I'm not sure we'll have an exact answer today, but there was an example to say if we provide food support and have 250 clients a week in which 100 are able to attest to the need due to COVID, then will they need to prorate the salaries?
Yeah, so we're only going to be able to reimburse for clients that can prove the need due to COVID. So yes, those will have to be broken out proportionally. So I don't think we're going to get anything too crazy with this simple calculation. Again, if you can provide 100 attestations out of 250 total, then we'll take that same amount from the salaries and benefits for those employees. if it's something like, you provide services to 100 people and you only get 99, I don't know that we're going to get into that level. We're trying to just make sure that we, so that's like a straggler sort of one-off situation. We're just trying to make sure that generally the services that you provide and that are eligible, which includes the attestation, are what we're reimbursing for with the American Rescue Plan's funds. Anything else right now, Amy, or should we move on?
The last question. So I've answered some in the chat, so try to look at your name. I'm trying to at folks as I answer them. There was a question that says, can you share that formula? I'm not sure if that was in relation to prorating salaries. So Candace, if you can provide some more specific on that. Then there was also a question around if there had been attestations in 2021 and we continue to serve those same families, does the same attestation work? So what are your thoughts on that, Emily?
I would say yes. At this point, we don't have a time limit on the attestation, and that would still be within the last year. So I would say that would work. If you received the attestation in 2021, you would need to get a new one for that same household or individual for 2022. I'm sorry, you're muted.
Sorry, yeah, this was actually farther back. The question was, the attestation was received in 2020, and they still worked with them in 2021.
We can look at an exact answer and get back with you. What I'm thinking I've seen is that they last usually a year. So if you got the attestation 2020, it would work for 2021, but not for 2022. You'd need to renew that. So that's my preliminary answer, but we'll check and get an exact answer.
Okay, so I think just a couple clarifying questions, and this sort of also applies. So I think it's going ahead to share. So there's a question about expenses. So, I had said future expenses January through September are eligible, but understanding that a funding decision won't be received till March, there's a question of, is the recommendation to start collecting attestations? It's really going to be based on organizations and the amount of eligible expenses that you wish to apply for. So if you do not have a client attestation process, you really feel strongly that you're eligible and you meet all the service requirements, then yes, you could start collecting those to make sure that those expenses are eligible. There's a question around, does the attestation need to be signed by the client, or can we have a staff member that attests for the client? At this point, all the attestations need to be from the individual served.
If it's a situation where they're physically or mentally unable to, sort of run that by us. Sometimes we can have like a proxy or a caregiver sign and they just, make an X or something. So if that's the situation, let us know. But in general, it needs to be the client themselves that signs the attestation.
Okay, there's a couple more, but I think I can get these. I'll just go ahead and respond to sort of nuances of some of the questions.
Okay. And we're going to have some scenarios after I go through 2B, and we'll have some more time for questions and stuff. So this is now your only opportunity to ask questions if you think of any. Okay, so we're going to move on to category 2B. So this category does have different eligible services. So if you're only applying under 2A, just bear with us for a few minutes. So this will be folks applying for 2B, and there are some of you who are intend to apply under both, I think. So this has a different set of criteria. And then one of the biggest differences in this category is that you have to provide the services in a qualified census tract or to families, individuals living in a qualified census tract. So what is a qualified census tract? And I will probably refer to this as QCT. So just a heads up, qualified census tract is a QCT. So it's any census tract in which at least 50% of the households have an income less than 60% of the area median gross income. So HUD has defined those. Here's the link to the website. So that is also in the previous webinar. If you don't want to wait to get the recording for this, we can send this out. You can Google HUD QCT map and it should pop up. So one thing I do want to point out, and I will mention it again as well. So in this screenshot, I selected 2022. So 2022 QCTs, there are some that are different in 2021. So there's like a couple up in Silverton, I think, and one maybe like in Cheviot that are QCTs in 2021, but are no longer QCTs in 2022. So you need to be careful in this category and these services, which we're going to get into in a second, that if you're applying for forward expenses, it needs to be in a QCT in this map. If you're applying for expenses in the past, which again is difficult, but if you are, you'll need to make sure there are a few additional census tracts that you might be able to have provided services in. So just want to point that out, that you need to be vigilant about which year you click on the map. Okay, so for the qualified census tract, so there's two different ways you can meet this criteria. So you will need to determine if the services that you provide, the eligible services, which again we'll get into in a second, if they're located in a qualified census tract in Hamilton County. So you can either do that by providing the services in a QCT. So, you know, we'll go back, well, let's see, we'll get into some scenarios in a second, but you can either provide the services in the QCT, or if the services are not provided in the QCT, you can document that the individuals or families that receive the eligible services live in a QCT. So there's two different ways that you can sort of meet this criteria. Documentation of whichever one you meet will be required. So if you provide services in a QCT, basically you just need to like tell us the address, which QCT it's in, and then which eligible services is. If you're going the household lives in a QCT route, we will need sort of attestations or something that shows that those people live there. So it'll be a little bit more documentation. If you have a client list, something, and you'll need to tell us which QCT those clients live in. So again, here's the flow chart. If you will have already completed your pre-application and sort of answered all these questions. So basically, we're just going through what the information you'll need to validate in the full application will be. So again, so this is required for each service that you provide. You'll need a detailed description of the program or service, and you'll need to provide details of the QCT where the service is provided and let us know what documentation you have that'll support it. So how do you have the street level addresses where they provide, or obviously just letting us know what location and QCT the services are provided in. And then you'll also need to describe the expenses for the services that you're going to request reimbursement for. And again, that'll be on a monthly basis that you provide us that documentation after grant award. And again, just reiterating that you need to make sure that your QCT years match the year that the expenses, that you incur those expenses that you're applying for. Okay, so here are, here's the first subcategory of eligible services. So this is homelessness. So services to address homelessness, such as supportive housing, improving access to stable, affordable housing among unhoused individuals, affordable housing development to increase supply of affordable and high quality living units, and housing vouchers, residential counseling, or housing navigation assistance. So I do want to mention we're not reimbursing for construction. Obviously, this is for services. Just want to make that clear. And then you're going to need to be very clear in the program description how you meet the whatever criteria you think you fall under. And you'll need to be as specific as possible. Like, so if you want to apply for residential counseling, you'll need to tell us, you know, how you meet that and how it helps, you know, prevent homelessness. So going back to that QCT in which years in, here's a little scenario. So you provide residential counseling in an area that is a QCT in 2021, but not in 2022. You would only be able to apply for those residential counseling expenses from March 3rd, 2021 through December 31st of 2021. So you just need to, again, just make a note of which year you're checking and which expenses you want to be reimbursed for. Okay. So education, I think this is probably going to be the trickiest for people. This is very specific. So it's very much focused on education. It's not anything really education related, like professional development or mentorship. It's very focused on education. So let's see. So some of the subcategories under education are new, expanded, or enhanced early learning services, including pre-kindergarten, Head Start, or partnerships between pre-K programs and local education authorities or administration of those services, providing assistance to high poverty school districts to advance equitable funding across districts and geographies, evidence-based educational services and practices to address the academic needs of students, including tutoring, summer, after school, and other extended learning and enrichment programs, and evidence-based practices to address the social, emotional, and mental health needs of students. So starting at the top, enhanced early learning, it needs to be one of those things listed generally. Can't just really be just a daycare program or just like, you know, some sort of, you know, summer program. Like it has to meet one of those criteria. Again, you're going to want to be very specific in your program description about how your program meets that criteria. And then if you're going to apply under one of the last two, the focus here is that evidence-based piece. So that means that you're going to need to tell us what model or other research the services or practices are based on and describe those to us. So we'll need details on whatever, you know, model or practices used if you're coming in under one of those second two. So again, this is going to be very specific. I have a feeling we'll get a lot of questions on that, so please just let us know. And again, you know, if you ask a question, you're still unsure, really you just need to be able to be very clear and detailed in explaining to us how you meet what category you're applying under. So in addition to the program description, we'll also need, again, the detail of expenses you want to apply to be reimbursed for and the QCT documentation. So I think in a lot of these, it might be just the location is in a QCT, but some of these, if not, you know, tutoring, something else, if you're going elsewhere, you'll need to let us know and describe how you document that your clients live in a QCT. Okay, healthy childhood environments is the next category. So this is new or expanded. So that's important. New or expanded high quality childcare to provide safe and supportive care for children. Home visiting programs to provide structured visits from health, parent educators, and social service professionals to pregnant women or families with young children to offer education and assistance navigating resources for economic support, health needs, or child development. And enhanced services for child welfare involve families and foster youth to provide support and training on child development, positive parenting, coping skills, or recovery for mental health and substance use challenges. So I think that that first one might be the tricky one for people. You'll need to, in any of these, you need to be very specific and detailed about how you meet each criteria that you apply under. And so that for that first one, it's going to be explaining that you're new or you're expanding high quality childcare to provide safe and supportive care. So in each subcategory that you decide to apply under, because a lot of people checked multiple. So if that's still what you intend to do, you'll need to meet each little piece of each criteria and tell us how you meet that. Again, as in the other categories, besides the program description, you'll also need to describe the expenses you intend to apply for reimbursement for, and then how you meet the QCT criteria. Okay, and then the final one is addressing health disparities. So this is funding community health workers to help community members access the health services and services to address the social determinants of health, which the Treasury defined in their ARP guidance. So that we listed that out for you right there. Addressing health disparities could also be funding public benefits navigators to assist community members with navigating and applying for available federal, state, and local public benefits or services. Housing services to support healthy living environments and neighborhoods conducive to mental and physical wellness. Remediation of lead paint or other lead hazards to reduce risk of elevated blood lead levels among children. And evidence-based community violence intervention programs to prevent violence and mitigate the increase in violence during the pandemic. So this one is a little different in that it's sort of vague, but also really specific in some cases. So for example, housing services to support healthy living environments in neighborhoods conducive to mental and physical wellness. That could be a lot of different things, I think. So you just need to be very specific and detailed about how you meet that category. And that goes for really any and all of these subcategories, is that you need to tell us how you meet each aspect of the eligible service category. And again, you can see the final point, the community violence intervention programs, those also need to be evidence-based. So same as those two education points, you'll need to tell us what model or research or that you use for that program, and you'll need to describe that to us as well. So under all of these 2B categories, so again, the overall categories are the homelessness, education, healthy childhood environments, and addressing health disparities, and then you'll need to pick under those which ones you fall under. Again, some of these general ones, again, this is still an eligible services category, so we're really going to only reimburse for the expenses directly related to provide an eligible service. So you can see all these at the top, still ineligible indirect cost rates still must be broken out, have detailed documentation. They'll still need to be applied for like on a prorated proportional basis. And then additionally, under this category, expenses not related to the eligible services, and if they're not provided in a QCT or to clients who live in a QCT, they will not be eligible. So these are the same as the other ones. Expenses related to providing eligible service are the salaries and benefits, direct assistance, materials, supplies, equipment, technology, rent, utilities. And then again, we just would like you to call out any new expenses that you have. And this one will also have the additional budget. So it'll have the first required budget for the 2022 expenses. And then if you wish to apply under 2021 expenses, it'll be separated as well. Okay, do we want to pause for questions, Amy?
Yeah, we have a lot of questions. So there are a lot of really specific questions when it comes to services. So we're going to get through some of these, but I also just want to reinforce that oftentimes it's helpful to have a very quick conversation to understand your services. And if we'd rather talk through it prior to you taking the time to fill out the full application. So send us over an email at impact@uwgc.org if you'd like to talk to Emily or anyone on the team about the specific questions. So there was a question from, I'm just going to sort of go back up. There's a question from Steve related to homeless, to healthcare, or to vaccinations and testing. And that's all I got there. And so there's look that doesn't fall specifically under homelessness services.
Mm-hmm. Yeah, so unless you can maybe qualify if it falls under health disparities and if it falls under one of those categories, but it doesn't seem like it falls under homelessness specifically from what I can tell.
Yeah, it would have to fit under the health category. The other thing we've had a couple questions on is verbal consents. So we'll make that an FAQ to follow up on that. It's possible, although there would still have to be pretty strong documentation. So we'd have to have a way to audit those recordings of those verbal consents. So we'll do some checks to see what that looks like and if we think that that's feasible or not. So look for an FAQ around that. And for the folks who have specifically asked it, we'll make sure to follow up with you individually as well. There also could be ways to do e-signatures, which was another thing that was brought up. There was a question around rent and utility assistance, that it is not included in this section, correct? And that is correct. So housing, correct. Yep, go ahead.
Yep, the county has other programs for that, and it's not an eligible service under the Treasury guidance for this.
So housing navigation, residential counseling would be for the could be eligible expenses to actually provide that service, right? The staff person doing that. If there are some material costs, like printing out information about where to find other housing, but there is no eligible expense for rent and utility assistance. There was a question around could we talk about if you're providing, I think that this is in relation to educational services to high poverty school districts.
Yeah, there is a category for providing assistance to high poverty school districts. Mm-hmm. Is that the whole question?
I think that was just, could you talk more about it? So it's educational based programs. Mm-hmm. That said, there still needs to be sort of the fact that the school in which you're supporting needs to be either located in a QCT or the families that you serve live within a QCT.
Yep.
There was a question that said we pay an inner city school for a scholarship. We pay an inner city school to have a scholarship for their students. Would this qualify as a qualified expense? I think we need to look at that.
We need a lot more details on that, I think, before we can answer that. Because I would think it could maybe fall under 2, but again, we need more details.
Yeah, we need to provide more context in which like the program in which that that funding or that scholarship is maybe facilitated. Some questions about minimums again. So just a clarification that the $25,000 minimum is for any funding under this Hamilton County nonprofit relief. So that's actually across all the categories.
Yeah.
One, if you're coming in under hardship, as well as 2A and 2B. So that's not a minimum per category. So you don't, right. It's not a minimum for 2A and a 25 minimum for 2B, it's combined.
Right.
And yes, you can apply to meet that sort of $25,000 minimum or try to maximize your grant by having multiple programs under either 2A, or you can have multiple programs that fit under 2B. You can have a combination of any of them under the category 2. But what you will see is that we'll be asking for sort of detailed descriptions of each of them because individually, each of those programs has to be eligible. Right. And then the expense also has to be eligible.
Yeah, and Amy, I just want to reiterate, since we're kind of talking about it, is that if you're also applying under organizational hardship, that is, if you can't tell so far, that's definitely the category you want to focus on and try to get, if you, whatever hardship you have, if you can get enough eligible expenses from January to September to meet that, that's really what I would recommend people's focus be. Obviously, if you don't have any hardship, then that's, eligible services is definitely our category. But we're also funding the organizational hardship categories first. So again, getting all the documentation and things, your application in for that is going to be in your best interest if you meet that hardship criteria.
There is a question around, where can we get a link to the PowerPoint? We'll send you as a follow-up to this, probably first thing tomorrow, a follow-up email that says, thanks for attending, and provide a link to the recording. And then by Wednesday, we'll have we'll have a copy of the PowerPoint to the online system or our website. So we'll let you know where to find all those in the follow-up email. Question about specifics around community health workers. Does that mean they need to be certified as a community health worker?
I have not seen anything about a certification, so I would say no.
I will say that that's a pretty specific model of community health workers. So that's where like getting specific into your program and sort of the approach that you take in that service is going to be really important. We had a question about our city of Cincinnati neighborhoods excluded. They are not. It's just Hamilton County. You just would need to make sure that if you are receiving city of Cincinnati specific funding, that you are not duplicating benefits.
Yep.
We said that rent was not eligible, and there was a question about mortgage that is sort of in the same bucket. So both rent and mortgage assistance and utility assistance are not currently eligible just because the county had put some other funding aside from that. So another question about rental assistance that will not be an eligible expense. A couple questions around specific questions around educational. I think really it'd be helpful if you can send us more, oftentimes we need a little bit more context than even the sort of a headliner of your program. So Mary had a question about a family camp for folks experiencing homelessness. Would it qualify under education, under enhanced services? And so I think that's under homelessness services. So send us a note or schedule a call. I think would be really helpful just to sort of let us know and we can talk through that. Okay, let's see. I'm going to try to get through a few more. They're coming in pretty fast. Okay, so there was another question. There was a question around does CPS fall under Q and under a qualified census tract? It would actually have to be school-based. So the
Mhm.
school would need to be in a qualified census tract. Just
Because
so,
some of them will, but not all of them. So it needs to be based on the census tract itself. And we're going to ask you to give us this qualified census tract.
2B, there's a question of do 2B services need to be COVID caused, or they can just be existing services to high poverty clients?
Yep, it's just
Yep.
this is the only qualification is that it is one of these services and that it's in a QCT or provided to people in a QCT. You don't need the attestations of need due to COVID or anything like that.
Yep. So all of 2B, the documentation of who you're serving or where you are serving is all that we need. It's not beyond that. And just the rationale again for this is that recognition that lower income communities, that lower income individuals that have less financial stability were disproportionately impacted by COVID. And so this is sort of the way of being able to document that they had a need.
Mm-hmm.
So there's a question about like a really detailed question about a eligible expense. So if someone was purchasing a piece of equipment that was required to provide services and they made a payment in December of 2021, but the remaining balance was due in 2022 of March, would the 2022 amount that's still due be eligible as an eligible expense?
Yes.
We'll post a link to the, I gotta find it, but it'll be in the application packet, but the link to look up qualified census tracts. You can also oftentimes, shoot a Google HUD census tracts.
Yeah, and we'll also add a lot of these questions to our FAQ document, which will be updated later in the week on NEC Impact as well as on our website. So if you miss an answer or something and don't want to email me, you can look it up there.
Yep, look it up there. Okay, a couple more, and then I think I'll look on the formal Q&A, but this will get us caught up on chat.
Okay.
So a question around, if my program is less than 25,000, can I apply? And that is a minimum. So if you believe you do not have eligible expenses to hit a grant award of $25,000, then you would not really be eligible in terms of being able to meet the minimum grant.
Yeah, and again, as Amy said earlier, it is across all categories. So if you only have like 10,000 under eligible services, but you have at least 15, you can meet under hardship, then you can still apply. So, but it is a minimum of 25,000.
And then there is a question around sort of allocation between the hardship and 2A and B categories. So if you want to just talk about prioritization, Emily, and then specifically there was a question of, based on the hardship grants, do we anticipate being able to make funding awards for 2A and B?
Sure. So yes, so organizational hardship, those are going to be funded first. Those do have priority. I think that we'll have plenty of funding for eligible services based on what I can tell. I can't guarantee that we'll be able to fund everybody that applies. There is no priority like 2A over 2B. We're going to prioritize a few things. There were a couple people who put in like a pre-application late. So, if we do run into funding restrictions, those people kind of go towards the bottom. And then after that, it'll be we have some different categories which will be communicated if we run into the situation. Again, I think it's rather unlikely, but based on how well if your program is what am I trying to say? New programs are going to have less priority rather than established. There you go. Established programs. Those will end up having priority over newly created programs for this purpose. And then if we still need to sort of whittle down after that, again, this will be communicated prior, but it'll be based on, need of population, need of organization, things like that. But again, there is $6.3 million. So I think it's unlikely. I'm optimistic that we'll be able to fund everyone that applies that has eligible expenses. So, but again, that hardship, those are going to be funded first. So if you meet the hardship and you have your expenses, definitely get those applications in. Anything to add to that, Amy?
No, there's a question around 990 as does that count?
Not by itself.
And it needs to be, and then there's a follow-up to that, that they said they wrote a letter. We need to see that, but likely that did not suffice unless they did either a full formal review of your financials or they went through a complete audit process.
Yeah, it's if you Google it, or if you ask, if you have a CPA, that does, if they just submit your 990, they should probably know, or you can Google it. There's the 3 different levels. Compilation's the lowest, and then there's a review, and then there's an audit. So a review, like, it's such a common, normal word. I think people are sort of misunderstanding that it's actually a pretty specific thing. But we do need, if you don't have an audit, we do at least need reviewed financial statements. So if you want to send us what you have, what you think works, or something like that, please let us know. We definitely want to get that cleared up before you try and fill out the full application, especially for category 2.
Was a couple of follow-up questions that I'll be able to do. So sort of still around client attestation. So just a reminder that under 2B, so if you have any other services that were under 2B, then attestation is not required under 2B. Emily, do you mind going back to the slide? It sort of shows the location and the house. So 2A, the way that you show that you're providing those services to folks with a specific need is due to attestation. If you're following under a category that is 2B, there's 2 ways to show it, but it's all related to qualified census tracts. So documenting where a household live, and we talk about this in the full application, and you'll be asked to sort of talk through how you collect that level of information, but you would have to collect a street address level piece of information to understand and verify that that individual is in a qualified census tract. But that can be through a traditional intake process. Does not need to be a new attestation. Or in the other case, if your services are actually located in a qualified census tract, you're able to show that already by being in that physical location, it's sort of presumptive eligibility that the services are reaching folks in need. There's also a question around sort of where does that requirement of attestations come from? Is it actually provided in the Treasury guidelines, interim final rule, or was this a requirement that was determined locally?
So the attestations for 2A, so there is a requirement that there is a need due to COVID. And so the United Way and the county have determined that an attestation is the easiest way to do that. So that's because it's also 2A is specific to client need. So it has to be on a client level. Rather than having submit documentation that the client has some sort of like financial hardship, that they lost their job or something, we're just going the route of the attestation. So I think that hopefully answers your question.
And then there was a question around sort of providing services that may be shut down for a little bit temporarily due to COVID, sort of using these funds to reopen those services and get them up and running again. I would say as long as the program had been in operation, maybe there was just a temporary shutdown, very specific to COVID, that these can be used to sort of make sure you're up and running and providing services. But really specifically, the eligible costs are going to be related to not only documentation of those costs, but documentation of the individual served. And let's see, two more. There was a question about if there's sort of like an element of a service component that's under 2A, but maybe wrapped into a 2B category. So for example, in this case, is Patty's asking about that they provide emergency food, but it's really part of their work around social determinants of health. Would we recommend applying under 2A or 2B?
I would say that's, I mean, feel free to contact me. We can talk it through specific details. Just based on that, it's really up to you. I would probably say 2B if you know you're in a qualified census tract, and that's where your services are provided. That's a little bit easier than getting attestations from each client. Again, it's kind of, what processes do you already have in place? Do you already get attestations or some sort of intake you can add an attestation to? Maybe that is easier. So it's, unfortunately, it kind of depends. But feel free to reach out if you want to talk about specifics.
And then just going back to the question around the amount of funding that's available, and Emily, I would just want to go back to this, but at this point, based on an initial review of those applications, we do expect to have additional funds to be able to make grants under 2A and 2B.
Oh, there will definitely be plenty of funding to make grants. The only thing I can't guarantee is that we can fund everybody under 2A and 2B. But there's definitely plenty of funding that all the hardship people, all the people applying under hardship already, I know, will not be able to meet that $6.3 million, even if they all have all their documentation and all their expenses. So there will definitely be funding for 2A and 2B. I just can't guarantee that everybody who applies under those categories will get to be funded. We don't have all the applications for hardship, so we can't really say at this point, but there definitely is going to be some funding. So I think that hopefully that answers the question.
Yeah, so just clarification on that means that at this point, there will not be sort of like additional communication around the amounts. We're sort of running them parallel. So, and in some cases, organizations may be coming in both. The idea to sort of stagger was to sort of get a head start on organizational hardship, because it is a little bit of a simpler process, as folks who have participated in both of these webinars probably see that the eligibility, the program level specific eligibility under 2A and 2B is a little bit trickier, because it starts to become much more narrow than the general eligibility of providing social and family services. It's really about your models at a program level basis. And additionally, then there's the layered in of documenting who you're serving, or where, it's who you're serving and whether that's through an attestation because of the need, or where they live, or where your services are located. All right, I think we got through most of the chat questions. So we'll, and Q&A, I'm just sort of typing up some of the ones that were live answered. So you want to go ahead and move forward with process, and then we'll be able to open it up at the end for verbal questions as well.
Okay, great. So I'm going to do some scenarios and examples real fast. Hopefully that'll help people. And then we'll go through a little bit of the application and the process before we do some more Q&A. And just to reiterate, you know, just kind of summarizing the different categories like Amy just did a second ago. So 2A are those very specific job training, food assistance, home repairs, weatherization, and then the behavioral health care. And for those, you need the client attestation that they needed that service due to COVID-19. And then separately is category 2B, under which you have all the subcategories, but the general ones are homelessness, education, healthy childhood environments, and addressing health disparities. In those, you qualify by whether the services are provided in a QCT or whether the individuals you serve live in a QCT. So just summarizing for folks, because it does get quite confusing, especially if you're intending to apply under both. So working through a few scenarios that we've either already had questions on or we think might be applied to a lot of people. So the first one is about organizational eligibility. So our organization has reviewed financial statements from 2017. So we checked the box for having reviewed financials on the pre-application. Are we eligible to apply for funding? No, the independently reviewed or audited financial statements must be recent, which is 2019, 2020, or 2021. And the full application does require you to upload a copy of those reviewed or audited financial statements. Scenario 2, eligible services 2A. So our nonprofit runs a food assistance program in the QCT. Are we eligible to apply? Maybe. Food assistance falls under category 2A. So QCTs are not taken into account. You must be able to provide client attestations if they have a need for the food assistance due to COVID. Scenario 3 is also about eligible services category 2A. We've provided emergency food assistance since the beginning of the pandemic. We have received some funding for this purpose, but not enough to cover our expenses. We would like to apply to cover the total additional cost from April 2020 to September 2022. Is that eligible? So the portion of the contract from March 3rd, 2021 through September 30th of 2022 is eligible. Note that you must also provide the client attestations for all food assistance for which you apply for reimbursement. So that would be starting in March of 2021 and going through this coming September. The portion from April of 2020 through March 2nd of 2021 is not eligible because direct service any expenses cannot have been incurred prior to March 3rd of 2021. Scenario 4, eligible services 2A and 2B. We've operated a food pantry for a few years. We have some volunteers that have been conducting mental health counseling during the pandemic. Are we eligible to apply for both? Yes. To qualify under food assistance, you'll have to provide client attestations they have a need for the service due to COVID, and expenses will need to be directly related to providing the food assistance. You are maybe eligible to qualify under behavioral health care. You will need to have provided consistent programming and services and have eligible expenses. And you'll also need client attestations for those clients if they have a need for the service due to COVID. Eligible services 2B, scenario 5. My organization conducts an evidence-based community violence intervention program and has since 2017. Our services are provided in a census tract that was a QCT in 2021, but is not a QCT in 2022. Are we eligible to apply for funding? Yes, but you may apply for reimbursement for expenses for the eligible service from March 3rd of 2021 through December 30th of 2021. You cannot apply for reimbursement for the services in 2022 because they were no longer provided in the QCT. Scenario 6, eligible services 2B. We are a religious organization that operates a food pantry program to provide pandemic relief. The site is not in a QCT, but some clients live in a QCT while others do not. Are we eligible to apply? Yes, purchasing the food and direct costs to provide the program are eligible for the clients who live in the QCT. But other general operating expenses, expenses for other programs, and expenses for food assistance to those who do not live in a QCT are ineligible. You will need to document client addresses to confirm that they live in a QCT and expenses related to just serving those individuals. Scenario 7, eligible services to be. Our organization runs a student leadership and mentorship program. We can collect the client attestations from the parents that they live in a QCT. Are we eligible to apply? Maybe. Educational programs must be evidence-based, and you must describe in detail in the full application the evidence-based model or practices used to provide the services. You'll also need to provide the name of the evidence-based model or practice that you use. Scenario 8, hardship and eligible services. We are applying for organizational hardship for $300,000. We also want to apply for eligible services for our job training program for the unemployed at an estimated $200,000. Is that eligible? Technically, yes, but assuming you can provide expenses for reimbursement for operational expenses, as well as eligible expenses for the job training program, the maximum award per organization is $250,000. So if you're applying for organizational hardship for $300,000 and you have that amount of operational expenses from January to September of 2022, the maximum is $250,000. So if you're confident that you have that, you don't need to apply for eligible services because you won't be able to receive any additional funding on top of the $250,000. Okay, so a few takeaways. So we talked a lot about the different kinds of services, but I do want to reiterate what you need for each. So these are just some examples for category 2A, something like food assistance and mental health counseling. You need to fully describe the program based on the given description. You'll need the client level documentation, which for 2A is the self-attestation. And you'll also need to describe and list out your expenses related to the eligible service. And I do realize, obviously, most people are going to be looking forward, so we do know that it's an estimate. So, you should be able to have a pretty good idea based on past expenses of what your future expenses will be. But, we do realize that you're not submitting the actual documentation at this time, so it is a bit of an estimate. And then for category 2B, such as homelessness and education, you'll also need to fully describe the program based on the given description. Again, details and specificity, you need to show us that you are eligible under which program you say that you provide. And under 2B, you'll need client level documentation, which is either showing that the service is provided in a QCT or telling us how you're documenting that your clients live in the QCT. And then again, you'll also need to describe and list out those expenses related to providing that service. And just to be clear, you can't mix and match between 2A and 2B requirements. So if your eligible service, for example, food assistance, falls under, it does fall under 2A, you will need that self-attestation. You can't use the QCT criteria. Same thing with, education services. You can't use the self-attestation for that. It has to be within a QCT. Okay, so I'm going to go through this real fast before we open it back up to questions. So this just talks a little bit about the process. So eligible organization. So these are the different steps, basically, that general steps we're going to be looking at. Is your organization eligible? Is it an eligible use of funds? And then do you have eligible expenses? So we talked a little bit about this already, but should should proposals exceed the availability of funds, we will, and again, we'll communicate this, but we'll score proposals again based on some of the criteria listed, like did you submit your pre-application on time? Obviously, hardship is going to be funded first, and then if needed, which again I think is unlikely at this point, but we will prioritize based on some other criteria. The proposal process. So for eligible services, the application, you'll receive an email on Wednesday with next steps to complete the application in AC Impact. So you'll have to answer the application questions online, and there will be some documentation that you'll be required to upload. If you're applying under category 1, organizational hardship, you should have already received, whoever completed the pre-application would have received the email for to complete the organizational hardship application in EC Impact. Those applications are due Tuesday, January 18th at 5 p.m. For the eligible services application, those are due at midnight on Sunday, January 30th. In all instances, late applications will be deemed ineligible and will not receive funding. This is just a quick list of the basic information to provide. It'll all be listed out in EC Impact. We will also have a PDF available of the program summary and application document on Wednesday. Okay. Back to Q&A. Amy, do we have any other questions at this point?
I think the only new question we had talked about, if you had attestations already, could they sort of last for longer, go forward? There was a question about going backwards. So if they served someone last year, but were able to get an attestation this year, would that turn that into a qualified expense?
I think I would suggest in the attestation forum that you use, if you're getting that attestation newly, like now, that you add it was a service provided in the past, and maybe say that they had a need due to COVID. But I will we'll research that a little bit, the attestation piece and going backwards. So we'll provide an answer in the next couple of days.
So all of these questions will also be turned into an updated FAQ document that we should have likely around Wednesday. But as you can see, it's often very helpful just to give us a quick call if you still have some questions about this or have some, don't have enough clarity around how to apply, and if spending the time on the application is right. We really want to make sure folks feel really confident about their eligibility. And so that, by the time you do the application, that we're really collecting all the additional information we need from a due diligence perspective to verify the amounts and make funding awards and do some slight prioritization, perhaps, as we know that we'll have funding to make grants under the category 2, but may not be able to sort of fulfill all of them. So send us an email. Sort of see it again, impact@uwgc.org. Emily's answering many of those questions. We have another tonight. Laura who's answering some, and I'm jumping in here and there. So much more to come moving forward. One last question, and then I think we'll close it down unless anyone wants to raise their hand and ask a question. There's a question around, would clients be able to receive assistance multiple times, so long as that there is an attestation each time for the service? Yeah, there is not necessarily a limitation of how folks are served. And I think the question is sort of, what type of service are you providing? So if the program involves multiple touch points, then you really just need one attestation that they are accessing sort of this program due to a due to a need. So we can, again, having details of that is actually more helpful. If you can send us a note to say, what's the actual service you're providing? And with that, we're going to hold to time since we're already over. Well, as Emily said, we'll get all of this up, and we'll also follow up with a follow-up email that lets you know when the webinar link and the other materials are available online.
Yep. All right. Thanks, Amy. Thank you all for attending, and please email us when you have questions.